Hi, Dr. Sunir Garg. Thank you so much for joining us. You're giving a presentation at ASRS on hypersonic vitrector settings in surgery. Could you give us an overview of your presentation?
Hypersonic vitrectomy is really the first new way we've had of doing vitrectomy since it was invented. We've all become accustomed to our guillotine cutters, and they work great. The guillotine cutters have gotten better over time. They've gotten faster. We're now up to 15,000 cuts a minute. But they have some potential drawbacks to them. As the instruments get smaller, the lumen gets smaller, and as the lumen gets smaller, the efficiency of vitreous removal can slow down some. And because there's a guillotine involved, sometimes the ports close, which can also reduce efficiency. The hypersonic vitrectomy looks to just change things a little bit, and there's really no oscillating or moving, there's no moving parts per se. The tip oscillates at 1.7 million cycles per minute, so it's super fast, and the port's always open, so you can efficiently remove gel. So myself and my colleagues from five centers total looked at 70 cases that were having vitrectomy for a whole host of diseases, including retinal detachment, macular punctures and holes, siliconoil removal, and retained lens material. And we were looking at our initial experience with it, as well as to try to get some sense of how we can optimize the technology. And what we found is that compared to guillotine cutters and compared to what we're used to, it really worked very well. All of us were generally very happy with it. We found it to be no slower than traditional vitrectomy, perhaps faster in some cases. But there was definitely a learning curve to it. As we were doing the cases, we were sharing ideas, we were trying to optimize the settings. Sometimes you need to change the vacuum. Sometimes you need to change, not the cut rate, but the stroke rate in order to efficiently remove the vitreous or other materials in the eye. And then we were looking at our outcomes with it, and our sense was that it was pretty comparable to what we were used to. So it's really exciting technology. There's still a lot more work to be done. Dr. Mockmer didn't start after his first 70 cases and say, I figured out how to do pneumatic cutters. Obviously, there'll be evolution and development of the technique over time, and that's where the robust retina community will really be very helpful.
And how can this information help the day-to-day surgeon in his practice?
I think it's super exciting technology, and for me, that's kind of the main thing. It's a different way of thinking about how to approach retina surgery. When I first started using it, I thought it was a traditional cutter, just faster, but that's not really the way that it behaves. It's a different way of removing the vitreous gel. And if I'm a practitioner, I think it's something that I want to stay up to date on. Maybe it's worth trying right now, but I don't know that it's something that I would anticipate using tomorrow in my clinic. And I think as we get more familiar with it, more people will start to use it and adopt it and hopefully like it.
Okay, thank you very much.
Thank you very much for having me.
Yes.